Well, hi, I'm Deb Levy. I'm the Director of Surrogacy with ConceiveAbilities, and thank you for coming to our session. What I would like to talk to you about is just give you the brief rundown on our surrogate program, how things run within ConceiveAbilities, and answer any questions you have. As you may have heard this morning, I'm a marriage and family therapist, and I came to directing surrogacy after having my children through surrogacy. Prior to that, I worked in an IVF center where I was the director of counseling, and I did psychological evaluations on egg donors and surrogates for about 9 years. But in the back of my mind, always really struggled with what happened with my own surrogacy experience. The agency that I worked with, I can't say they didn't do a good job, they just didn't view their job the way I wanted them to view their job. They saw themselves as a recruiting and matching service, and that's what they did. They recruited surrogates, they matched. They didn't do any screening and they didn't do any coordination. And obviously with my background in mental health, I really wanted to make sure that everyone feels the emotional support, both the intended parents and the surrogates alike, so that everyone knows that they're not on an island doing this, that they've got a team of people that are working with them to support them throughout the journey. So one thing that I had, an experience I had as a patient, was that the agency didn't do any screening, and so I went through 5 surrogates before one met my doctor's criteria. That cost me about 1.5 years. It cost me about $10,000, and that emotional roller coaster of getting excited and disappointed and excited and disappointed. And after about 1 year of doing that, I remember looking at my husband and saying, please just find a uterus. Like, that's all I needed at that point. Just find me a uterus. And so one thing when we started this program we said we had to do was pre-screen the surrogates. So before you ever see a candidate, we've already done a psychological evaluation on the surrogate and her husband. We've done a criminal background check on the surrogate and her husband, a credit check on the surrogate and her husband, a home evaluation, so I know exactly where she lives, with whom she lives, how she lives, the vicinity to a reproductive endocrinologist, what hospitals are nearby. We have all that information. And I was shocked to hear that some agencies don't even physically meet their surrogates before matching them. So we want to be in their home with their family and get to know how they live. And then we have 3 nurses on our staff that do nothing but review medical records. We want to make sure that there's nothing in their medical history that's going to potentially preclude them from getting pregnant or complicate the pregnancy. We've been really lucky that we've only had, in the years we've been doing this, 2 surrogates that have went to physicians and didn't meet medical criteria. Now, I've never looked inside their uteruses, so I can't promise you that there's not going to be fibroids or scar tissue. But in reviewing their medical records and with the screening that we do, it's really a good insurance policy that when you're matched, everything is going to go through smooth sailing. It doesn't mean we can prevent miscarriages. It doesn't mean that we can, prevent all the hurdles that may come, but we're, as much as we can, decreasing the risk for you as an intended parent. So that's a little bit about the pre-screening. And then when I worked with my surrogate, the agency never contacted either of us throughout the whole pregnancy. So I felt like I had to take care of my surrogate, like it was my job to make sure she was eating okay, how was she doing, and maybe it's because of my nurturing personality, that was just me, but I knew that if she was doing okay, that meant my baby was doing okay. Well, as parents, I think you have enough to worry about. You have enough to be anxious and excited and all those different feelings about. You don't have to take care of your surrogate. That's our job. Certainly if you'd like to, that's fine, but also know that we're caring for her. We're checking in with her weekly. We're following up with you after that. We physically see her once a month at our support groups. We have in-house support groups, so we know exactly how they're doing emotionally, if there's any hormonal issues, if there's communication issues between intended parent and surrogate, we're going to know about it. We do everything in-house so that we can control the situation as much as possible. When you use various outsourcing, things can get lost. And I want to make sure that we know how all of our surrogates are doing so that I can talk to you and say, you know what, she's doing great. Here's what she reported to her case manager. This was what happened at her doctor's visit today. We'll have all that information for you. So that's a little bit about her psychological support and the communication with you. You'll have one case manager that will take you from start to finish. If you use a surrogate with us, an egg donor with us, we'll manage everything, one person. You'll have a point of contact from the day you sign with us until really about 6 months after delivery, when we know all the medical bills have been paid, that your surrogate is doing okay, you're home with your baby, your babies, your name's on the birth certificate. We've facilitated all of that. We work with a lot of specialists, such as attorneys that specialize in reproductive law. And we want to make sure that you're put in good hands so that you know that the legal aspect is taken care of. That's a little bit about the program. Questions so far? Please don't be shy with me. Why don't we run through the financial component? Okay. Actually, in here are some of our packets. I'm going to have you guys take one of these. Give me one of these. Would you like one also? You're good? Okay. You have one? Okay. Amy, do you want one? You're good?
I'm good.
Okay.
Thank you. They cost so much money.
Like
It's so
them?
beautiful.
Thank you.
Absolutely.
If you don't mind my making a comment to your audience or attendees here, your screening process is tremendous
Well, thank you.
and so important, and certainly not to be found at every agency. So you should be acknowledged for that.
Well, thank you. Tell us what you know about our screening process, Amy.
Well,
Can I call on you? Can I pick on you?
you can pick on me. The fact that you're presenting pre-screened
Mm-hmm.
GCs means exactly that your intended parent is not traveling that part of the journey, which
Right.
is emotionally challenging, financially challenging, time challenging.
Right.
You're starting them off at stable ground, and that's incredibly impressive. You've got medical staff, impressive. You've got in-house mental health, impressive.
Thank you.
Yeah.
The other thing that I want to point out is that our case managers are really professionals in the field. We have nurses, we have social workers, we have licensed counselors, people that have been intended parents, people that have been surrogates. Those are all of our case managers. So they know what you're going through. They've been in this field long enough that they know the drill. There's nothing that's going to surprise us anymore. You know, when I first started, when I was a patient, everything surprised me. You know, I couldn't believe this could happen or that could happen. Now nothing surprises me, and we can guide you through any situation that may occur, whether it's a miscarriage, whether it's a failed cycle, whether it's communication issues between you and your surrogate. We can manage that with you so that you're not alone. There's no surprises. So to run through the financial component, if you guys want to look in the packet, there's the fee structure. I don't know, does everyone see that? Okay, perfect. So I'm going to go in chronological order because I think it makes more sense. So I want you to start at the bottom of the page with the agency fee. I want you to know that there's no surprises either with the financial component. We have everything on our website, so you know exactly what you're dealing with from a financial expectation. So the agency fee is $18,000. It's broken up into 3 installments. The first is the retainer, and that's what we need to get you started. The retainer is $4,000, and with that we're going to find you a gestational carrier and make sure that she gets through her medical workup with your physician. Once she has medical clearance, we'll ask for the next installment of $9,000, and the final installment of $5,000 is due at the time of embryo transfer. Okay, questions? Just jump in and interrupt me if you have questions. Okay, let's go up to the top to the surrogate fees. Okay. So when you match with your surrogate, you're going to start to pay her a monthly stipend. The monthly stipend is $200 a month, and that covers things like her mileage over 50 miles, over-the-counter medications, parking, childcare when she goes to her doctor's visits, the miscellaneous things. So you're not getting receipts for $5 here and $10 here. And then know that that goes on until 2 months after she delivers, when she has her 2-month checkup with her OBGYN, okay? So that's $200 a month. On here we have it estimated at, this is a 16-month relationship. That might be a little high. Maybe it's a 14. Just know that it's $200 a month that you're paying. And then when she has her embryo transfer, she's compensated $1,500 for the IVF cycle. If she doesn't get pregnant, that's been her compensation, is $1,500. If she gets pregnant and we get to 2 ultrasounds that confirm a viable pregnancy, that's usually at about 8.5 or 9 weeks of the pregnancy, that's when her compensation will start. Surrogates are compensated $25,000, and it's broken up into monthly installments. So each month she would get $2,500 apiece. And if at any point, God forbid, she miscarries, something happens, that compensation will stop right there. Okay? What will happen then is if you try again, do another transfer, the agency fee is all going to roll over, her compensation will start again. Okay, questions? You guys all with me? Yeah?
Is there any difference between fees of the one child and twins?
Yes. If you want to flip over your sheet, you'll see the variable expenses. If a surrogate is carrying twins, she's compensated an additional $5,000. If she carries triplets, she's compensated an additional $10,000. Obviously, that's a more complicated pregnancy. Any other fees? No, it's the same. It's just for the surrogate compensation. Okay. While we're on these variable fees, I want to point out a few things, because this is where, when you're budgeting for this, it can make your head spin because there's so many variable items. There are so many things that we can't predict. I wish we had a crystal ball and we could predict all of it. We can't. So if she's carrying twins, she's compensated, as I said, an additional $5,000. If you choose to work with a surrogate who's been a surrogate previously, her compensation is an additional $5,000. Then there's things like life insurance, disability. Let's talk about those. I haven't seen many cases where intended parents purchase disability insurance for their surrogate, because honestly, there's usually a one-year waiting period before you can file under a disability plan, so that defeats our purpose. If she has short-term disability already, great, we can utilize that. Life insurance, most intended parents end up purchasing life insurance for their surrogate, and for a term life policy for a healthy, say, 30-year-old for a 9-month period, it usually amounts to about $350, $400 for the course of the pregnancy. Now let's talk about maternity insurance coverage. We could talk for days about maternity insurance, and quite frankly, the talk I'm going to have with you today is different than it might have been last week. It's changing day to day to day. So back when I had my kids, if the surrogate had maternity coverage, we filed under that and no one knew or cared if she was a surrogate. That's not the case anymore. More and more insurance plans are writing language into their contract saying surrogacy is excluded. There are some plans where it's very clear, surrogacy is excluded, end of story. There's some plans where the language is a little bit gray. There are some plans where there's no language at all regarding surrogacy. And then there's a handful of plans that say, yes, we cover surrogacy, but many are a yes, but. Yes, we cover surrogacy, but we can bill the intended parents up to a percentage. Or yes, but we reserve the right to bill them what the surrogate's being compensated. When you match with a surrogate, we are going to have a professional, well, before you're matched, we have a professional review her plan so that I can show you what her plan says. Now, we have the Affordable Health Care Act that hypothetically is going to be starting January 1st. There's language in there saying that from an individual plan, you can't exclude maternity for any reason. We're assuming that that applies to surrogacy. So, assuming that this all starts January 1st, as it's supposed to, my gut says that we are going to have insurance coverage through individual health exchanges that will cover your surrogates. Because this is changing day to day, I still always want to advise every single one in this room to talk to an insurance specialist, because what I'm telling you today may be very different from what we're hearing a month from now or 2 months from now. So know that insurance has been historically a moving target. We don't know where it's going to end up.
But by January 1st, we'll know one way or the other, presumably. Right?
Presumably, before the government shut down, they said yes, January 1st. And now they're saying they're making some changes to the Affordable Health Care Act. And because the government shut down, we don't know what they are. I hope that there's not going to be a national exclusion for surrogacy. But there has been talk of it, but I haven't seen it thus far. So, again, we have to talk about this day to day, because that can be a huge variable in your budget. Historically, purchasing the Lloyd's of London insurance for your surrogate, which is the comprehensive care, can cost between $24,000 and $37,000. So when you're budgeting, that's a huge chunk. And so it's important to know where we are with the state of healthcare before you sign up for any program, so that you know exactly what to budget for. Questions about insurance? Because I know that's about as clear as mud. Okay. Yes?
Is egg donation included in in the front? Or
No, actually, egg donor is separate, and I'm going to talk about that after. Excuse me. So health insurance is definitely a huge variable when budgeting. Then there's things that can come up throughout a pregnancy that you need to be aware of, whether it's a medical complication, she loses her uterus, she has an invasive procedure, whatever the case is, you're going to see on there that there's compensation for your surrogate for those events. That is not including your medical care. That's just for the surrogate. Okay, questions there? You guys are looking at me with blank faces, so I want to make sure you're getting it. Then if you want to flip back over to the front side, you'll see that there's a psychological screening and support. So as I mentioned earlier, we pre-screen all the surrogates. When you match with your surrogate, we're going to bill you for the screening that we've been done. And then additionally, as I mentioned, we have our monthly support groups for which you're going to be billed $200 a month for the psychological support for your surrogate. And then what you'll see is legal fees. We have a lot of wonderful attorneys in the field, like Amy sitting here, that will work with your case to either represent you or your gestational carrier. And the average legal fees for intended parents are $3,500, and average for the gestational surrogate is $15,000. Now I tell you average because it varies state to state. It also varies on what the attorney has to do. Do they have to go to court? Do they have to, what's going to be done in this case? But those are averages that you can budget with, okay? Then if you want to flip back over to the chart, I want to talk about escrow, okay? We work with an independent escrow account. It's not someone that's in-house. We work with a bank that's in Chicago that's been around for 100 years, so you know they're reputable. You'll have an escrow account that's completely transparent to you. You're going to have an account with your name. You'll see the event that triggers the payment, what the payment is, and the date. So it'll say embryo transfer November 1st, $1,500. You'll be able to follow along. Now, when we open your escrow account is when you match with your surrogate. We'll have you open your escrow account with $19,000. And then before the embryo transfer, we're going to have you put $54,000 in the escrow account. This is going to pay for your surrogate's compensation, the agency fees, your surrogate's legal representation, and any co-pays or deductibles or anything that may come if you're using the surrogate's insurance. If you're purchasing insurance, you'll pay that directly. If you, when you work with your reproductive endocrinologist, you'll pay him or her directly, and you'll pay your attorney directly. Questions about escrow? Let's talk about egg donation. We have 2 egg donor programs that you can utilize, and one is our basic program. It's $4,900, and that's going to include your surrogate or donor's legal representation as well as insurance. Then we have our fundamentals program. A fundamentals program is basically like insurance. It's $8,700, and what that says is if your surrogate gets to or doesn't get to 20 weeks of the pregnancy after using all of the embryos that the donor has created, you're going to get your full agency fee back. Okay, so that's the egg donor program. Questions?
So you have your own egg donor?
Mm-hmm. Yeah, we have an egg donor pool. Where's my, I can show you if you'd like. We have a database where you can go on and you can put what criteria you're searching for, and whether it's location, education, hair color, eye color, whichever criteria you're searching for, and then see nationwide which donors may come up based on that criteria. Okay. Questions with that?
Well, I'm just confused because some of the clinics obviously have their own
Yes.
egg donor pools, and I'm just not completely clear because they say they do more pre-screening than the agencies do for their pool.
With egg donors, they're probably right. When I worked in the clinic, they do a full medical screening on their donors. What I found is that the clinics just don't have as many donors as agencies. So you know what? Start with your doctor. Look at their pool. If you don't find one, then come to us and we can help you. We'll probably have a broader range of donors for you to select from, but she has not been medically screened yet. Okay.